Gentlemen, let me ask you something honest, man to man. Have you ever been in the heat of the moment, wanting so badly for your partner to feel that same incredible rush of pleasure you're feeling, but you notice she's not quite there? Maybe she clearly enjoys the closeness and the connection, but that peak, that actual climax seems just out of reach for her. Or maybe, if we're being really transparent, it doesn't happen for her at all during intercourse. If that sounds familiar, I want you to know right now, you are not alone, and neither is she. Clinical studies tell us a striking story. While the vast majority of men climax during intercourse, a very large percentage of women do not, at least, not without a specific kind of stimulation. So here is the million-dollar question. Is there actually a way to boost her chances of reaching that peak without all the guesswork or the awkward trial and error that can sometimes kill the mood? Well, science actually has some very firm answers. Researchers have gone as far as using ultrasound and 3D imaging to measure blood flow to the clitoris in various positions. And the data is clear. Some positions make a massive, measurable difference. Today, I'm going to share with you the 4 best sex positions for female orgasms, all backed by real science. And make sure you stick with me until the end, because I'm also going to share a few bonus techniques you can layer onto any position to make intimacy more satisfying for her and more confident for you. But before we dive into the data, do me a quick favor and tap that like button. It helps this video reach more men who are looking to improve their lives. Also, let me know in the comments, where are you watching from today? I love seeing this community of men from all over the world coming together to level up. And of course, hit subscribe. Every week, I share evidence-based advice to help you stay strong, healthy, and confident, both inside and outside the bedroom. For decades, we've been fed a specific narrative. Movies, magazines, and even locker room talk have painted this picture that if a man just lasts long enough, his partner will eventually be satisfied. We've been told that penetration alone should be the gold standard for pleasure. But here is the truth, and it might be a bit of a shock to the system. Most women do not orgasm from penetration alone. Now, I want you to hear me clearly. That is not because you are doing something wrong. It is purely a matter of biology. The vast majority of a woman's pleasure centers are located in the clitoris, a structure with over 8,000 nerve endings. For context, that is double what we have in the head of the penis. The biological reality is that many of those nerve endings aren't even stimulated during standard penetration unless the angle, the pressure, and the position are specifically calibrated. This isn't about luck, and it isn't about magic. It's about physics and blood flow. With the right knowledge, you can dramatically improve her odds of reaching orgasm without needing to be a mind reader. If you're new to the channel, hi, I'm Dr. Jocelyn. I'm a urologist, and for the past 5 years, I've specialized in men's health and intimacy. I've sat across from countless men and couples who feel like they've hit a wall in the bedroom. I've seen firsthand how these conversations, though they might feel a little awkward at first, can completely transform a relationship. Because let's be real, when a woman struggles to reach climax, it doesn't just affect her, it affects you too. Frustration builds, your confidence might take a hit, and sometimes couples just quietly accept that this is just how it is. Science tells us it doesn't have to be that way. In a landmark 2022 study, researchers measured clitoral blood flow during different positions. The results showed clear winners positions where women experienced significantly higher arousal and a much greater probability of climax. Let's count down those top 4 positions, and I'll break each one down in 3 ways. Biologically, what's happening in her body, emotionally, how it affects your bond, and practically how to actually do it tonight. Position number 4. Sitting face to face. This position might not rank the absolute highest for raw clitoral blood flow, but it is a powerhouse for intimacy. The biology. By sitting upright and facing each other, you create moderate, consistent stimulation. Because you are both vertical, gravity isn't doing the work for you, which means you have to be intentional with your movements. The emotional impact. This is where this position truly shines. It allows for constant eye contact, kissing, and whispering. For many women, feeling emotionally safe and deeply connected is the biological green light the brain needs to allow an orgasm to happen. If she's stressed or feels disconnected, her body will clamp down. This position opens everything up. The practice. Try this on a sturdy chair, the edge of the bed, or even sitting on the floor with a few pillows for back support. It's less about the mechanics of thrusting and more about the closeness of the grind. Position number 3, the coital alignment technique, the cat. This one is a bit of a hidden gem. It's a favorite among researchers because it focuses on the mechanics of pleasure rather than just the act of penetration. The biology. Instead of the standard in and out thrusting of missionary, you shift your body slightly higher up. Your pubic bone or the base of your penis should be making direct, firm contact with her clitoral area. Then, instead of thrusting, you rock together in a sliding, rhythmic motion. Ultrasound imaging shows that this creates sustained, targeted pressure that penetration alone can't match. The emotional impact. Couples who master the cat often describe it as feeling like a dance. It's a shared rhythm. It reduces that performance anxiety you might feel because the goal shifts from how long can I go to how well can we move together. The practice. It takes a little communication. The first time might feel slightly off because you're not used to the rocking motion. Don't be afraid to laugh, adjust, and talk it through. Once you find that sweet spot, it's a game changer. Position number 2, missionary with a lift the pillow trick. Don't let anyone tell you missionary is basic. With one tiny scientific adjustment, it becomes one of the most effective positions in existence. The biology. When a woman lies flat, the angle of the vaginal canal and the position of the clitoris aren't always aligned for maximum contact. However, by placing a firm pillow under her hips, you tilt the pelvis upward. This alignment ensures that with every movement, your body is pressing directly against the clitoral hood. Ultrasound studies show a significant spike in blood flow with this simple hip elevation. The emotional impact. You get all the benefits of missionary, the closeness, the skin-to-skin contact, the ability to see her face, but with a much higher success rate. It makes her feel prioritized because you took the small extra step to ensure her comfort and pleasure. The practice. Keep a firm decorative pillow, not a flat sleeping pillow near the bed. Slide it under her lower back hips at the right moment. It's a small move that yields huge biological rewards. Position number 1, woman on top face-to-face. The gold medalist of the 2022 study. This position consistently showed the highest levels of clitoral arousal. The biology. In this position, she is the pilot. She controls the depth, the rhythm, and most importantly, the angle. She can lean forward to ensure her clitoris is making direct contact with your body. The control allows her to find the exact millimeter of stimulation she needs to cross the finish line. The emotional impact. For many women, being on top is deeply empowering. She doesn't have to hope you'll find the right rhythm. She can create it herself. This sense of agency leads to deeper relaxation, which is the ultimate prerequisite for orgasm. The practice. Your job here is to be her anchor. Provide the connection and the support, but let her lead the pace. If you're used to being the one in charge, this shift in dynamic can actually be a huge relief and a massive turn-on for both of you. Positions set the stage, but these 3 techniques, what I call the intimacy toolkit, ensure the show goes well. The angling rule. Even a 2-inch shift in her hip placement or the way you tilt your pelvis can change a dull feeling into a sharp feeling. Always be willing to micro-adjust. Shallowing. Don't assume deeper is always better. The densest concentration of nerve endings is actually near the entrance. Focusing your energy there can be much more intense for her. The pairing principle. Science shows that up to 70% of women climax more easily if intercourse is paired with manual clitoral stimulation. Whether it's your hand, a toy, or her touching herself, don't make her choose. Integrate it into the position. I want to pause here because I know some of you might be thinking, Dr. Jocelyn, I've tried these things and it still hasn't happened. Is it hopeless? I want to reassure you, it is never hopeless. Every woman's body is a unique map. What works for one couple might need a little more fine-tuning for another. The real secret to a great sex life isn't a perfect position, it's curiosity, communication, and patience. When your partner feels that you truly care, that you aren't rushing her, and that you are exploring with her rather than just performing for her, that is when the magic happens. Your worth as a man is not measured by a stopwatch or the number of orgasms you provide. It is measured by your presence, your attentiveness, and the connection you build together. Let's recap the science of satisfaction. Woman on top for maximum control. Missionary with a pillow to tilt the odds in her favor. The cat for rocking, rhythmic pressure. Sitting face-to-face for deep emotional bonding. Gentlemen, age is not the end of passion. Your body might change, and her body might change, but the capacity for pleasure and connection only grows deeper with time if you stay curious. Small adjustments like a pillow or a different angle can lead to massive improvements in your quality of life. I want to hear from you. Which of these positions or techniques are you most curious to try out? Or do you have a go-to adjustment that works for you? Drop a comment below, I read them all. If you found this helpful, give me a like, share this with a friend who wants to keep the spark alive, and make sure you're subscribed for more real talk on men's health. I'm Dr. Jocelyn. Take care of your health, take care of your relationship, and never stop being a student of the people you love. You are worth the effort. I'll see you in the next video.